Hi, my name is Brielle Smith. I'm a second-year medical student at MUSC and a leader of the Community Vulnerability Project. Today's topic is COVID-19 and multisystem inflammatory syndrome in children. I am joined by Dr. Elizabeth Mack, the Chief of Pediatric Critical Care at MUSC Children's Hospital. Dr. Mack, thank you for joining me.
Thank you for having me.
My first question is, what is multisystem inflammatory syndrome in children?
Yeah, so it's had many names over the last few weeks and months. Most recently, as of today, June 1st, 2020, it is named, as you said, multisystem inflammatory syndrome in children. We're looking at people that are less than 21 years of age. We're looking for fever greater than 24 hours, which is a lot of children, but there are a lot of other criteria as well. And then specifically for laboratory evidence of inflammation, because this is really a reaction to something gone haywire, and then hospitalization. So this is not something where kids are generally out there in the world that are just kind of walking around with it. It's severe enough to require hospitalization, and then 2 or more organs involved. And then there's no other explanation for it, which there are a lot of sort of things that look like this. And then finally, current or recent infection with SARS-CoV-2, which is the virus that causes COVID.
What is the connection between this syndrome and the virus that's causing COVID-19?
For this disease in particular, the MIS-C, it is part of the definition is that you have to have evidence of infection or exposure to someone with this virus, this viral disease. And so it is specifically an inflammatory process that isn't explained by someone else that is in association with SARS-CoV-2. So that is actually part of the definition of MIS-C.
Another prominent term I have heard is Kawasaki disease. Can you explain if this relates at all to the current disease?
Yeah, so interestingly, folks around the world, particularly those in Europe and Asia that saw COVID-19 first before it came our way, they noticed an uptick in what we classically would call Kawasaki's disease, which is also a kind of a conglomeration of symptoms where the immune system has gone haywire. And they said, this is way more common than we would normally see Kawasaki disease. And so looking back, many of those kids had either active infection or evidence of infection by their blood work related to SARS-CoV-2. And so, in fact, Kawasaki's in this context today, in June 2020, would require a strict evaluation. We would really be looking deep to see if somebody either had SARS-CoV-2 infection or had recently been infected with that virus, because we would want to know whether it was in fact just plain old Kawasaki's or if it's kind of the syndrome that's classically now been associated with this viral infection.
How soon after being diagnosed with COVID-19 could a child exhibit symptoms of MIS-C?
So it could be the case that the child actually shows up and that's the first that we know of the infection. In other words, you can be currently infected with the virus and also have this inflammatory syndrome. Or you could have been infected. Likely it's going to be within the last month or so. And so that is probably the more common scenario as we're learning more and more about this, that in fact it is your body's reaction to prior infection and a wild inflammatory response related to that.
Dr. Mack, thank you so much for your expertise on this topic.
Thank you.
Thank you for joining us for this segment of MUSC COVID-19 Community Outreach and Resource Awareness.